it really does depend on the patient's condition. So first you got to do your physical examination. If there is someone who has a flexible hammer toe deformity, I'm usually
What does that
starting off.
mean?
Oh,
If you
sorry.
did this.
I'm talking to you guys. You know what I'm talking about. We're talking about the audience. I know. Okay. A flexible meaning it's like you can still bend the toe like up and down, if it's flexible, but sometimes it just rests in this hammered position. Then I will start with just soft tissue procedures, and I can do that in the office minimally invasively. So I can numb up the toe and do a flexor release and have that toe straight.
What's a flexor release?
I basically loosen the tendon on the bottom that's contracting the toe downward. So I just cut it and it goes right straight and it's fine. For people who have rigid deformities or are stuck, like in this position.
That's what we call hammer time.
This is what we have, hammer time. And they usually have like little corns, and maybe sometimes they tried to put like little salicylic acid patches on them. And especially for people of color, like if their skin is brown and then that little corn is white, it looks terrible and it's painful. Those people I am taking to the OR. I'm taking them to surgery. I am a fan of implants. I like to use toe implants because I find I have a better result with them for the long run. I do take insurance. It does depend on the patient's insurance on which implant that I can use. But lately I love using Osteo. They have toe implants, and they also have like a 3.0 nail that I can like make into an implant. For those of you who don't know what Osteo is, it's basically the same density, same material as your bone. And when you implement it into your body, it absorbs. Like your body will absorb it, or absorbs probably not a better term, but it becomes bone essentially. So you can't see it on x-ray. It's not metal. It's not something that can loosen, or if it does loosen or break, it just like gets absorbed. When it's metal, you actually have to physically take the metal out and do wonders in order to fix it. Using Osteo makes it a little bit more streamlined, and the patient's body will do the healing. So I like using the Osteo toe implants to fix hammer toes. That's what I like to use for that. And for bunions, I'm a fan of lapiplasty. I mean, like I said,
yes, we've heard about the lapiplasty.
Here's the thing, like, if you want a biomechanically sound foot, which means if you want to stand up on the ground and not have your toe go like this, like no amount of soft tissue balancing is going to fix your bunion.